nursing scholar and ethicist, wrote, "A great deal of study and research has been done to help determine safe care. A great deal is known what constitutes safe care. So there really is no justification in saying we just don't know, or the data is inconclusive, or it's just a judgment call. Those statements, every one of them, are at the very least untrue. We do know. I'm here today to tell the public, our legislators, and our loved ones that your health matters to me and the 180,000 nurses here in Illinois. I call on all of you to support the House and Senate bill and demand we pass the Safe Patient Limits bill. Thank you, Senator Castro and Representative Crespo, for understanding that patients' lives matter over hospital profits. And I'll leave you with this. Please, really hear the nurses today share their stories of caring for your loved ones. And please know, nurses are worried, and you should be too. Thank you.
Good afternoon. Sorry I'm late. I'm Fred Crespo. I'm the proud sponsor of House Bill 2604, which is going to pass, right? Yes. That's the whole plan. Yes. And we've been fighting this battle for quite some time. I'll tell you, I think it was like 7 or 8 years ago we were talking about this, and I think back then we were working with the SEIU. I was a legislator for only 2 terms at that time, and I just realized that sometimes you think you're doing the right thing, that this is a slam dunk. It just doesn't work that way. There's just so much opposition, and people just give you a gazillion reasons why this is a bad idea. This is personal for me, and I'll tell you why. I know how much and how hard nurses work. How do I know that? I've been married to one for almost 35 years. That's why I'm a good man, because they have good nurse behind me. And I've seen, and talking to my wife, and yes, based on observation and talking to her friends, how tough it is to be a nurse. And this is a special breed of person. Nurses don't get into the profession because of the money. This is a special type of person who really, truly cares about people. But this goes beyond a ratio for nurses. Let me just tell you, and most of you already know this, there's cost containment in these hospitals. We have nurses who are called an hour or 2 before they go to work, and they're told, don't come to work today, the census is low. They might be at work, and halfway through their shift, they say, you need to go home now because our census is low. And those are things to deal with. And here's the problem. When you ask the hospitals and you ask the administrators, how did you come up with the census number? Nothing. Nobody knows. They just come up with a number that has an impact on their lives. Now, it's amazing to me the way we treat nurses. When you look at firefighters, when you look at police, and I would say that the work that you guys do is as equally as important, if not more so, than what they do. Now, it's important for us who care about nurses to work together. I know there's a couple other bills out there. We'll be meeting and talk with those folks as well, but we need to work together. This is an issue where we need to make sure that nurses are not looked at as an operational expense. That's the problem. We're going to hear from the IHA, the hospital, say, well, listen, if you demand and mandate that we put a limit as to how many nurses we can have or how many we need, well, we're going to have to find a way to cut costs. When I will say to them, I know where you need to go. Look at your CEOs. We have a non-for-profit in this state. And I will mention what this nonprofit is. The CEO made $17 million last year. $17 million. And I realize if you run a business, it's a zero-sum game. You have to pay for stuff. The question is, you need to prioritize, where do you want the money to go? I want the money to go where the nurses are. I want to make sure that when patients come into the hospital or to any facility, that they're well taken care of. That's where the money needs to be at. So I'm going to work tooth and nail to get this bill passed. It's about time. I know California did it. I think ours is going to be even better. I'm just really amazed when I see so many nurses today. I love nurses, but when I see so many, I get scared. I'll close with this. I read once in one of the magazines that my wife gets at home, and I'll close with a statement. It was a statement made by a nurse, and she said the following, talking about her workload and the demands on her time. And she says, I didn't have enough feet enough hands to get the work done. I get what you're going through. I know sometimes you don't even take a break because you can't, because you really want to make sure you take care of that patient. We're behind you. We'll be behind you 110%. Thank you for coming to Springfield. I think you just came in today. You have to leave today, too, so God bless you. That's really rough. But thank you so much for coming out today.
Good afternoon. My name is Pat Mead. I've been a nurse for 30 years. I have been a nurse assistant. I have been assistant patient care manager in a ICU level 1 trauma. I now am a PACU nurse. So I've been around. I've seen plenty. I'm here today to talk about the what if. This is at the crux of staffing issues today. Hospitals will tell you on the day-to-day, we can't staff for what if. Well, I'm going to talk to you about what if. What if your patient develops chest pain? What if your patient gets short of breath? What if post-surgically your patient starts to bleed? What if your patient needs blood? What if they have a reaction to the chemotherapy? What if, what if, what if? It isn't what if. It's what does, can, and will happen, not every now and then, but on the day-to-day, the minute-to-minute, and the hour-to-hour. And then where does that leave the nurse? That leaves the nurse going, she's still liable, always. What did the nurse didn't do? How come she didn't do it faster? What was she thinking? Why didn't she call somebody? Who did she call? Who didn't she call? She is one person. She may have 6, 5, 4 other patients as well. What happens to those patients while this patient is now in trouble and she has to focus her care? And in the back of her mind, she's like, well, what about my other patients? Well, I should be doing something for them. Who's going to take care of them? What can I do? Who can help me? Well, if they've HE'd and canceled all the nurses, there is no one to help you. You do the best you can, and we always do the best we can, because no matter what happens, the outcome, which we hope to God is good, you run this scenario forever. It does not go away. You second guess yourself. What should I have done? Maybe I shouldn't have. Yes, you should have. You did everything you were supposed to do as you were supposed to do it as best you could. But the what ifs, they're not what if. It's what is every day. We have to put something into that makes it official, that backs us and backs our patients, because of course their safety is at the root of it. We all want our patients to have good patient outcomes. I just want to throw in about the dirty word acuity. It isn't. They don't staff, they staff by numbers, they don't staff by acuity. Acuity is how sick you are. Patients are older, patients are sicker, they've got kidney, lung, cancer, diabetes, shortness of breath, they've got COPD. All of those things cause them to have delays, setbacks with their recoveries. And we have to be on top of that. We can't sleep it. We need to be on the first symptom that changes. We need to be addressing that and reporting it. We can't do that the way that we are doing now and feel that we are doing the best we can for our patients. So it's not what if. It's what is, what will be, what will continue to be, unless we all stand together as we are here today in this great state house, and we talk to our legislatures and we ask for their support, because we need safe staffing limits in Illinois, and we need them now. Because what if it was your family member, or God forbid, what if you were the patient?
Good afternoon. I'm Melissa Bertoletti. I'm an ER nurse. I've been a nurse 25 years. I work at St. Joe's. I'm here to tell you my story about safe patient limits. I was a triage nurse about 3 years ago. I was in the triage area, and it was packed, wall to wall, people screaming. The back of the ER was also filled. There wasn't a room, and I checked in a woman. She had flank pain. Her vitals were good at the time, and I checked her in. She sat, everybody was sitting for a long time. So she sat for about an hour, and then I noticed she was on the floor. And her husband come up to the desk while I was triaging someone else. My wife is on the floor, please help her. I'm like, okay, I'll go help her, let me finish with this patient. She was on the floor, I was talking to her, I looked up. Now I'm the only one in there for about 20 patients and a line out the door. And I see this man walk in, he was clutching his chest. He was complaining of chest pain. He was all sweaty and gray. I knew he was having a heart attack. So I left the woman on the floor, and I said, I'll be back, and I ran to help the man. And we did I told the tech to do an EKG on him quick, and, he was having a heart attack. I called the charge nurse. They got him back right away. But when I got back to the waiting room, and the husband said, help. She's not breathing anymore. And he was talking about the woman on the floor. When I went over to her, she wasn't breathing, she didn't have a pulse, and she was unresponsive. So I called a code, and we coded her for a while, and she didn't make it. She died. She was about 45 years old. Somebody's mother, somebody's aunt just died right there. And the reason why that happened is because we didn't have another nurse in the triage area at the time. It was just me by myself. There was no one else to help. I think if we had another nurse up there, that nurse could have attended to the woman on the floor while I helped the man having a heart attack, and I really feel we could have helped her more than just leaving her on the floor. So I'm here today to help support safe patient limits in Illinois, and hopefully that would, never happen again. So that's it. Thanks.
Hi, my name is Gina Barrett. I've been a nurse for 22 years. I work at UIC. Right now I'm in the OBER area, which is the ER for pregnant women. But right now, I want to talk about something that happened when I was a nurse in labor and delivery. The story I have is more about what is good about having some safe patient limits. I was in charge, and there was a nurse who had a patient who was about my height, very short, but very round. And she was pregnant with a very big baby. And she always said that she was supposed to have a C-section, but it wasn't in her chart for some reason, so they let her labor. And she got to complete and was pushing, and the baby's head got stuck and got that shoulder dystocia that Doris was talking about. Well, it seemed like an eternity. It was probably a minute or more while the baby's head was stuck, and you saw the baby turning blue and dying right before your eyes. And they finally get the baby out. They totally carted the baby, doing chest compressions, giving medications right in front of the mom who's just delivering, crying, please don't let my baby die. Please don't let my baby die. Please, please help my baby. And of course, we all did what we could, but her baby passed anyway. Everyone in the room was very distraught, and especially the nurse who was taking care of her. She could not deal with it anymore. So I volunteered as the charge nurse to go ahead and take over that patient's care. And I'm glad that there was enough staff that night to give that grieving mom the attention that she deserved. Because if we were busy and everyone had their 2 patients, and that nurse was not only responsible for that mom of a baby who just died, as well as another laboring patient, And I had to oversee all these other nurses that each had 2 patients that also I was supposed to cover for lunches. There's no way that I could have taken that time out for that mom. So, and to this day, that mom and I, we're friends. She actually invited me to the baby's funeral, and since then she's had twins, and they've grown up. They're 8 years old now, and she's doing great, I'm happy to say. But I'm also happy to say that because we had safe staffing that day, that turned out to be a better day than it could have been if we hadn't. So please support this bill for safe patient limits. Thanks.
Good afternoon. My name is Lori Christopher. I'm a nurse at the University of Illinois. I've been a nurse for 22 years and came into the profession. It was a change of career. I was in my middle 30s, so I had been around the block and was appalled. They never taught us this in nursing school, what we would face on our assignments. You get out and you just cannot believe. I saw early on that this definitely was something that needed to be changed. So for the last 22 years, I've been very active in my profession. I cringe when I hear nursing shortage because I know a lot of nurses like me in nursing school were never taught what they would be facing, and they leave the profession. And this is a constant vicious cycle, and this is why we need to fix this. Nurses should not have to work under these conditions. I personally have suffered 2 family members due to short staffing. My sister's fiance, the coroner said and took pictures, it was the worst case of neglect she had seen, and it was all related to the care that he received. So I ask all of the legislators that I will speak today to think about your family, yourselves. No one knows when they're going to be in a hospital bed and that they will need the care of a nurse. We need to make sure that there's always going to be a nurse at that bedside whenever they need, that patient needs a nurse. We've heard the stories today. It's just, again, unacceptable. I said recently to colleagues, I said, how could we have laws for kennels of caring dogs or daycare providers for caring for children, but we have nothing for nursing for when we save patients' lives? This is it. We are not going backwards. We are moving forward.
Good afternoon. My name is Paul Pater. I am the chair of the Illinois Nurses Association Political Action Committee in an emergency department at the University of Illinois, Chicago. I'm here because I love being a nurse. Helping people in their most desperate time of need is my calling. There's nothing quite like the feeling you get when you know you're surrounded by a team of world-class professionals ready to tackle any challenge that rushes through those ambulance bay doors, and knowing that a job well done can save someone's life. What I don't love is when hospitals and administrators take advantage of our empathy and sense of duty to our patients to force unsafe situations on the nurses of Illinois in a misguided attempt to save money. I have personally worked in facilities where, as an emergency department nurse, I would regularly have up to 8 patients at once. I would transfuse blood, de-escalate dangerous situations with violent patients, and actively implement life-saving procedures in medicine, all of this simultaneously administered and often unaided, because there weren't enough physicians or nurses on staff. No nurse should ever be put in the position where they are forced to prioritize between delivering potentially life-saving care for one patient while leaving the critical needs of another untended for any amount of time. Given the challenges we face, I cannot begin to understand why, in a time of a nursing shortage, healthcare facilities aren't doing more to retain highly skilled staff. We know it's not cost savings, since each percentage point drops in nurse staffing costs the hospital over $300,000 on average. I know nurses, and I know that we will always do everything in our power to save our patients. But that doesn't give our lawmakers or administrators leave to structurally undermine our ability to provide that care. No patient deserves to be ignored by a healthcare system that only sees the value of human life in dollars and cents. Let me make this very clear. With each additional patient assigned to a nurse beyond this bill's ratios, there is a 7% increase in mortality due to treatable complications. For the sake of patients, nurses, our families, friends, and communities, I thank Governor J.B. Pritzker for his ongoing support of the nurses of the Illinois Nurses Association, and I implore our legislators of the Illinois State House and Senate to join him in passing this bill and making it law. Thank you.
So it looks like we're out of time. Thank you, to all of our nurses and our bill sponsor, Fred Crespo, for coming and speaking today. And I guess we're out of time, but if the media has any questions for any of our nurses or bill sponsors, we can answer those after we're done. So thank you.